More commonly in my practice now, when we do top surgery for folks who are assigned female at birth, we're not only addressing the chest, but also the torso as well. And in this video, I'm going to go through 3 different ways we can address the torso at the same time as top surgery. The first is a reverse tummy tuck, or what I call Masculoplasty Plus, which is where we remove extra skin from the upper part of the belly at the same time as top surgery. The next thing we're going to jump into is torso masculinization, which we typically do with liposuction. And then we're going to talk about a tummy tuck, a full masculinizing tummy tuck. Also, we typically use liposuction with that too, and what's involved. So Masculoplasty Plus is one of my favorite things to do because it's really clever, it's really slick. At the end of the day, it is nice and clean. It looks just like top surgery. The incisions end up underneath the pec muscles in the same place as usual. And it's very useful for 2 types of patients. So the first type of patient it's useful for is somebody who's lost a lot of weight and they have a lot of loose skin in the belly. And so what we're doing is we're dipping down onto the belly and we're pulling all the skin tighter so it can make the entire appearance of that belly look better, but your scars end up in the regular place. The second type of patient it's useful for is just somebody who carries their weight in the upper folds on the belly. So sometimes underneath the breast we have upper folds as well, and we're able to get rid of those at the same time as top surgery. So this is Masculoplasty Plus. Takes a little bit longer in the OR, but the recovery is pretty much the next type of torso procedure we're going to talk about is good old torso masculinization. And in the vast majority of patients, we're using liposuction to achieve this. So typically what folks ask for is to get rid of the curves. So we're going to want that hip to waist ratio closer to 1, so a more straight up and down look, or in more athletic folks, even a more kind of natural or cut look to their abdomen. So depending on the patient's anatomy, we'll focus on getting rid of the curves. Oftentimes we'll tone the abdomen, see if we can uncover a 6 or an 8 pack while we're there. And we do this through usually 3 little incisions, 2 hidden in the belt line, 1 in the belly button. And the really nice thing about this is once we get rid of those fat cells from the curves, the fat is not going to, even if you gain weight, the fat won't come back to the curves. You kind of have more of a dad bod if that were to happen. So this procedure is getting really popular. You can do it on its own. I did a few last week with revisions, or you can do it at the same time as regular time. Sometimes the right procedure to do is what we call a masculinizing tummy tuck. And so this is basically for folks who want to get rid of the curves but have extra skin, such as in this patient. And so what we're doing is we're making sure our curves are gone as much as possible. Usually we'll combine in some liposuction, but we're also going to get rid of loose skin on the belly. So this is a bigger surgery. It can be combined with top surgery. This particular patient was having a revision at the same time, and we combined it and we basically redid the top surgery because there was a lot of tissue left behind. This one adds a fair amount to your recovery. Usually it's about 4 weeks off work as compared to 2, and usually a good 2 to 3 months off heavy lifting and working out. But the cool thing is we can do it drain free also, and we do it in a way to make sure we don't cinch in the waist too much, so it still will be very affirming.